Hello, I'm Dr. Shivadev. I'm a psychiatrist and a sexual medicine specialist. I have MD in psychiatry and I have done a fellowship in the European Society for Sexual Medicine, and we deal with male and female sexuality. Erectile dysfunction. What really is erectile dysfunction? There is a lot of confusion about it because different people have different perceptions of erectile dysfunction. Erectile dysfunction really refers to a condition where there's inadequate flow of the blood to the penis, and thereby the rigidity of the penis or the strength of the penis is not completely achieved to enable a complete and enjoyable penetrative intercourse. But this definition can really depend on who is experiencing this, because even a small amount of change in the blood flow can cause a disturbance in some people, whereas 30-40% or 50% of blood is sort of not enough to maintain that. So there are grades of erection dysfunctions which we need to understand, and how it is really important clinically and what cause of disturbances is happening in these areas is something important to understand in a clinical setting. There are various causes of erectile dysfunctions. So starting from physical causes, which can be your general medical conditions such as your diabetes and hypertension. Diabetes causes a lot of changes across our entire body because these causes vascular changes right from, if you understand why you're diabetic, or your internal medicine specialist asks you to check your retina, isn't it? Because that's the microvascular changes or small changes which happens in your blood vessels, which is a similar change which can also affect your penis and thereby affect your erections. Hypertension can also cause a problem because right from the medications which are given to control your hypertension can change the way the blood flows into the penis or outside of it. There are some leaks which can also be because of vascular malformations in the penis, which can also affect the rigidity of erections. And moving on to the hormonal aspects, conditions such as hypothyroidism or testosterone deficiencies are known to cause significant changes in the way your arousal mechanism works, where therein the erections is a part of the arousal mechanism, and thereby a person experiencing these hormonal changes can have erection dysfunctions. Your psychological makeup, your belief systems, the way you're thinking about your problem can really affect how you're perceiving these things, because the brain is one of the most important sexual organ which coordinates a lot of factors right from your blood flow, your nervous system changes and your hormones, and your relationship with the partner also becomes important because as humans we have highly evolved and we cannot perform sex like animals, so we need that connection, we need partners to understand us, and we need to understand our partners and have a very good relationship with each other to be able to enjoy the intimacy in the way that it's actually meant. So thereby, ED requires a detailed diagnosis and evaluation by a qualified sexual medicine specialist so that you don't end up taking wrong treatment or over-the-counter treatment, etc. for these conditions and end up in complications. Or I would also not recommend reading some online blogs or posts randomly which may not be the complete medical information but rather land up in anxiety. So please consult your sexual medicine specialist today for you to be able to understand what are the various aspects and how to get over it. This definitely is a reversible problem and you don't have to worry about it as a permanent or a lifelong problem.